Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Thank you so much for joining The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. I'm also the founder of Oneka Bariatrics and Wellness. You can learn more about me and get connected at www.drshanibelgrave.com. I am excited to welcome to the show today Dr. Obehi Asemota. Dr. Asemota is a highly accomplished fertility specialist who joins the show to share her expertise. Dr. Obehi Asemota, thank you so much for joining the coalition.
Thank you so much for having me. It's a pleasure to be here.
Yes. And so I am super excited to kind of continue part two of a dialogue that we have been having surrounding fertility. Before we get into all of that, can you please tell us a little bit about who you are and what you do?
Sure. So I am a board certified fertility specialist, founder of Hope Fertility. We have 2 locations in Metro Atlanta, and we have been open for almost 6 years now.
Wow, congratulations.
Thank you.
And so what is it about fertility as a specialty? How did you pursue that?
So I initially thought I wanted to deliver babies, but then I during one of my rotations when you're in medical school or you are exposed to different fields, I was fortunate to be exposed to fertility, and I just loved that it was ever evolving, ever changing. So what we do now is so much different from what we were doing 20, 30 years ago. So that's a field that would always keep me on my toes, keep me interested. So that was something that I just fell in love with and I decided to pursue.
Fantastic. It's always good to be involved in progress and continual advancement in our specialty. So that's amazing. So what can you tell us about male factor infertility? I feel like that's something that's not as commonly discussed.
Yeah, I'm glad we're talking about this because most people think it's just a women's problem, but we know a lot of times, a lot of cases that infertility is either solely due to male factor or male factor contributes to the infertility. And it can come in a variety of ways, right? Male factor, what we usually call male factor is that the semen analysis is abnormal. It could be the amount of sperm is low. It could be that the sperm isn't moving. It could be that the shapes are abnormal, or it could be there's no sperm at all. But it could also present as sexual dysfunction, so ejaculatory dysfunction. But it is a common cause of infertility and one that should not be ignored. So for couples where there's a man and a woman, it's important to evaluate both partners and not just the woman, which is usually what we tend to see. I tend to see, oh, just make sure it's me, but we have to make sure your male partner is also examined because it could be a contributing factor for infertility.
So how can some of those things be treated in the event that it's found that it's on the male side?
Yeah, sometimes it could be something as simple as supplements. Sometimes some medications like Clomid, some aromatase inhibitors could be given to a male patient. This is where the urologist comes into play. They're the specialist, like a male fertility urologist would be the one to prescribe that. So if it's sometimes medications, but sometimes surgery. So some men, they have dilated veins in their testicle. Right? And that actually could affect sperm count or the semen analysis, and that could be surgically fixed. That's called a varicocele. So a varicocele could be fixed. So it could be medications, it could be surgery, but even lifestyle. Sometimes excessive alcohol, obesity, drug use, testosterone is a big one. A lot of people don't know that testosterone is like birth control for men. Men who take testosterone, it actually shuts down your sperm production. So even lifestyle changes sometimes could fix the male factor infertility. So medication, surgery, lifestyle. And then if all that fails and there's hopefully sperm, there is advanced treatment like IVF with ICSI, where we actually take the sperm, inject into the egg. So fortunately, in this day and age, we have a plethora of treatments available.
And then another thing I was curious about is many times there's familiarity concerning fertility and women's age. Is there, with decreasing fertility beyond a certain point as women age, is there any connection with decreased fertility in men as they age?
To some extent, not as pronounced as women, but we do start to see some effects of aging on the sperm, usually in like late 40s, early 50s. Not like pronounced like in women when we see it in some women late 30s, early 40s, but to some extent, aging does affect sperm.
Okay. And then looking at fertility also from the woman's perspective, what are some common causes of infertility for women?
Oh, it could be the most common, I'll tell you, is anovulation. So some people don't ovulate regularly, a condition known as PCOS. That's very common. But other things like anatomic abnormalities, like for example, if tubes are damaged, that could cause infertility. A medical condition called endometriosis, that could cause infertility. Um, and then other things like sometimes even just missing your fertile window, because I find some patients don't even know when their fertile window is. So infertility can be caused like by a lot of things.
And then when should people seek a
I
consultation?
would say it's never too early to get answers because, best case scenario, we can tell you, oh, you're a little early, continue time intercourse around the fertile window. But the textbook answer to that is if you are younger than 35, you've been trying for a year, you should see a specialist. If you're over 35, trying for 6 months, you should see a specialist. But there is never too soon to get answers. So if you've been trying for 3 to 4 months and you just want to know if everything's okay, that is not unreasonable. Like I said, best case scenario, we can check and say, oh, everything's fine, just continue. You haven't been trying that long to be considered infertile, and we can give you some sort of reassurance. So never too early. That's my answer.
Okay. And are there any myths surrounding fertility that you would like to dispel? Have you heard anything circulating like if you do this, you can get pregnant, that you found to be a common myth that is false?
Oh, that's a whole that I could speak a whole day. There's so many. There's so many. I mean, the one I just heard the other day was after intercourse, you should lift your legs up. There's so many, and our job is to dispel myths, right? It's important you go to someone who is trained to treat fertility and not so much Google or Reddit. There are so many myths out there. I've seen it all, heard it all. It's just important to seek a professional. And I mean, we would take hours if I started going through all the myths I've heard.
Well, I figured that would be a good one to talk about so that if people are trying and getting discouraged, to kind of take some of those off the table as things that are likely to work or that you need to invest time in trying if those are really in fact myths. So what is the process? Like, can you walk us through the process if someone has been trying for a year and they book a consultation, kind of what happens next?
So every doctor is a little different. The way I approach my patients is first we just get to know each other. Okay, how long have you been trying? What's your medical history? What have you done? What have you done at home? That comes into play about dispelling myths, right? I always tell patients if you have any questions, best to ask the doctor. Don't go on Google, don't go on Reddit. So first is just getting to know a patient. And then doing an ultrasound, just seeing if there are any gross anatomic abnormalities like fibroids or septums or polyps. And then evaluation, if all of that is done, is doing some basic blood work, looking at the four parts that are needed. Again, sperm, right? If you have a male partner, checking the tubes, checking the egg reserve, and then making sure you're in good health. And then based on all of that, a treatment plan can be formulated together.
And what happens with the cost? Is it expensive? Is it covered by insurance? How does that work?
It depends. Fortunately, some insurances are covering fertility. Some insurances cover everything. Some insurances cover nothing. If insurance doesn't cover anything, it can be expensive. Depending on where you go, prices range. So if you're fortunate, your employer might cover everything where you pay nothing. But some insurances exclude infertility as a medical diagnosis, where it has to be paid out of pocket, and it can be pricey.
Do you know if people can use their HSA to help with the cost?
Yeah, I have had patients use HSA and they can submit. Yes, I have seen that happen.
So I was thinking about when you mentioned PCOS and anovulation, and I was like, I should probably speak a little bit to that because there are many patients that have PCOS who, with weight loss, have had improved fertility. So I know we talked briefly about obesity and overall health, but just wanted to make sure I echoed that because that's something I have seen is people with significant weight loss after PCOS been able to conceive. So I just wanted to touch on that point.
Right.
What would be your, excuse me, what would be something that you would want people to know about infertility?
Seek help. Seek help and seek help early. I think that's the biggest thing. Because sometimes I see people who've been trying for 10 years, 9 years, 8 years, who've never, ever seen a doctor or fertility specialist. It's never too early to get answers. Like I said, best case scenario, if you're a little too early, we might say, oh, everything's fine, just continue within this time frame. If you're not pregnant, come back then. The biggest thing I would say, just seek help. Don't, infertility affects everyone, regardless of race, regardless of economic status, regardless of education level. So seek help and you're not alone. Someone like you is going through exactly what you're going through.
That's a great point. Have you, in your experience, found that there's any shame or that people feel reluctant to come in because of a sense of shame?
Oh, absolutely. Absolutely. Unfortunately, it's still taboo for certain people, certain cultures. Some people think they can pray infertility away, which is why I say the biggest takeaway I would like people to get from this is just seek help, seek professional help from a doctor who's certified.
Wonderful. Well, thank you so much, Dr. Obehi Asemota of Hope Fertility, based right here in Metro Atlanta. What is the best way for people to reach out to you and get connected?
Yeah, so we are on Instagram at hopefertility.com. And our website is hope-fertility, so hope-fertility.com if you'd like to make an appointment. We are located in Alfred and Lawrenceville, and we'll love to take care of you.
Great. Well, thanks so much for joining the coalition. We hope to see you back on the show another time.
All right. Thank you so much for having me.
Well, everybody, thank you so much for tuning in to another impactful episode of the Coalition Talk Show. I'm your host, Dr. Shani Belgrave. I am a minimally invasive and bariatric surgeon here in Atlanta, Georgia. You can stay connected with me at www.drshanibelgrave.com. Very special thank you to Dr. Obehi Asemota, an accomplished fertility specialist at Hope Fertility. You can get connected with Dr. Asemota through Instagram or also on her website. Thanks everybody for watching. Make sure you share this episode with friends and family to raise awareness on fertility. I'll see y'all next time.